Good morning, everybody. Today we're doing a pretty cool case. It's small. I'm well known for my big, complicated surgeries, but today we do surgery that people need. And so today we're doing a small operation called a discectomy. When we do a discectomy, we typically have to remove a small part of the bone that covers the nerves. This patient has had a discectomy in the past, so there's going to be some scar tissue over the nerves, which increases the complexity of what we're doing. The scar sticks to that thin nerve membrane. We call it the dural sac. And it also sticks to the surrounding bone. So there's a little bit of a challenge in going back in when someone has been there before. So in 2013, he had surgery, and now we're going back in. The same area has crowded the nerve again. There's a disc herniation along with arthritic changes that result in overgrowth of the bone, overgrowth of the joint, and crowding of the nerve hole. There's the nerve hole in the middle, and there's a nerve hole on the side, and both of those are compressed. So we're gonna go in and we're gonna open that space. This is called a revision laminoforaminotomy, medial facetectomy, and discectomy, which basically means we're going to just open the space for the nerves.